You're from which media house? First. Very good. And Nation Media House. Yesterday you showed one of my patients. You know, patients belong to Ministry of Health. The patients belong to me. Please tell your editors that that patient still has some money in his SHA. I've confirmed with the CEO. So he has not completed his cover. And next time, he doesn't need to go to Nation Media Center. He needs to go to SHA's headquarters, or he calls our call center 147. The number of facilities we have closed, we are closing every day. As I'm sitting here, the regulators are closing. But the ones that I have on my file, they are over 1,000, 1,058. And we shall close more. They are being closed for a number of reasons. And we have also downgraded about 458. They are at level 2. They claim to provide services of level 4. So we are telling them, if we downgrade you, once you reach your level, we will. Your next question was on cancer. Yes, there's a specialist here. Mercy? Yeah.
Well, Waziri, thank you for making me an oncologist today. I am not an oncologist, but I will explain to you the current benefit package that we have for cancer care. So under cancer care, Kenyans are eligible to 550,000 Kenya shillings. That's a little bit over 500,000 Kenya shillings. And this package covers for all types of cancer. Now, the journey of a cancer patient is particular in a manner where step one is to plan out the management of this patient. And step one involves diagnosis. We need to find out what kind of cancer do you have and what stage of cancer do you have. And to do that, SHA actually has and reimburses the tests required, the biopsies required to determine the diagnosis of the patient. Once we have the diagnosis of the patient, we then define the management plan. And the management plan can be surgical or medical or both. If it is a surgical plan, then surgery is actually catered for on SHA rates that are available in the tariff, depending on what part of the body would be excised, where the tumor would be taken out. Now, if this patient is determined to require both medical and surgical care will be covered by SHA, and we have those examples of patients who receive surgical care. Two, medical care will now involve chemotherapy cycles at that cap limit of 550K. And so erroneously so, the patient who came to your offices still has a balance in his cover and he has not exhausted his cover. And we're willing to help him. He just needs to dial 147 and we'll attend to his case and educate him on the cover and the availability of his cover. Now, once that is complete and the patient has exhausted all the cycles that they require, they then are upgraded to the ECCI fund, where we have an additional cover of 150K Kenya shillings. And so the cancer package under SHA is actually better and more comprehensive compared to that was in NHI.
Yes, I think that's all. The third one was what? The third question was on? No. If a facility, first I said facility must admit based on their bed capacity, which they have, which is on their license from the regulator. If they increase their bed capacity, the regulator's portal is online. They notify him, they can increase. But if you have more patients, buy more beds. If you have more beds and you have no place to put, build more wards. Simple as that. The problem, okay, there's a guy, the owner of the system. I can answer that question, but I think he can do better.
Thank you so much, Waziri. So the SHA provider portal system picks data directly from the regulator. So if your license says you have 10 beds and you update it in the regulator system, the SHA provider portal only consumes that data directly from the regulators. So if you have beds and you can't see them in the SHA provider portal, the place to go is not SHA, neither DHA. The place to go is your regulator. He looks at your license. He looks at the number of beds you need to have. He looks at your inspection. Then he updates. When he updates, it's real time. It takes less than a second to update in the SHA provider portal. Okay, on the issues of discharge, please ensure that we want to urge all our facilities that when a patient walks in, ensure that you have admitted that patient in the system so that by the time you are discharging them, the system is able to recognize them. If you have more patients than what has been discharged in the system, then what the system does is it calculates the active patients within the ecosystem and the number of beds that you have, and then it's able to lock you out. But we urge you that anytime you have patients that need to be discharged, also ensure that you discharge them in the system. We have found facilities that have patients in already who have left the hospital, but they have not discharged them in the system. That gives you a problem because then it is consuming those beds that you have been allocated. And SHA will use that data as provided for by the regulator, which can be KMPDC, it can be clinical counsel. Thank you.
Okay, good people. Asanteni sana.
Thank you.